Last Saturday, the 11th of March, marked 3 years since WHO first described the global outbreak of COVID-19 as a pandemic. That was a significant moment that caught the world's attention. However, from WHO's perspective, the far more significant moment was 6 weeks earlier, on the 30th of January 2020, when I declared a public health emergency of international concern. It may not sound as dramatic or as severe as pandemic, but a public health emergency of international concern is the highest level of alarm that WHO can sound under international law. We declared a global health emergency to spur countries to take decisive action, but not all countries did. 3 years later, there are almost 7 million reported deaths from COVID-19, although we know that the actual number of deaths is much higher. We're certainly in a much better position now than we have been at any time during the pandemic. I'm confident that this year we will be able to say that COVID-19 is over as a public health emergency of international concern. We're not there yet. Last week, there were still more than 5,000 reported deaths. That's 5,000 too many for a disease that can be prevented and treated. Last Sunday, WHO was made aware of data published on the GZAID database in late January and taken down again recently. The data from the Chinese Center for Disease Control and Prevention relates to samples taken at the Huanan market in Wuhan in 2020. While it was online, scientists from a number of countries downloaded the data and analyzed it. As soon as we became aware of this data, we contacted the Chinese CDC and urged them to share it with WHO and the international scientific community so it can be analyzed. We also convened the Scientific Advisory Group for the Origins of Novel Pathogens, or SAGO, which met on Tuesday. We asked researchers from the Chinese CDC and the International Group of Scientists to present their analysis of the data to SAGO. These data do not provide a definitive answer to the question of how the pandemic began, but every piece of data is important in moving us closer to that answer.
Any and all data that relates to the study of how this pandemic began be made available immediately. And why that is so important is so that the analysis can be done by an international group of experts from around the world in a scientific space, that can be done openly, transparently, that the data could be discussed and debated, and so that we could better understand the findings and what it means. The information that we have been made aware of, we were presented results by China CDC as well as by researchers from around the world who downloaded this data. What the researchers were looking at were the environmental samples from Huanan market. And amongst the samples that were positive for SARS-CoV-2, they looked and saw evidence of DNA of animals. And those animals included raccoon dogs, as well as a number of other animal species. This doesn't change our approach to studying the origins of COVID-19. It just tells us that more data exists, and that needs to be shared in full. We need to continue to collaborate with our Chinese colleagues and work together to understand all of the different hypotheses. What we look at as scientists is we follow the science, we follow the analysis that is done, and we look for these different types of clues that lead us into different directions. At the present time, we don't have all of the information in front of us.
If ever any of you have ever tried to do a jigsaw without seeing the actual picture that's behind the jigsaw, you know that the more pieces you have in the right place, the more you start to see an image. But you're never really sure of what you're building. You're never sure what one piece does until you put the piece in the context of all of the other pieces. And then a picture starts to grow. And your level of confidence as to what that picture is grows as you put more pieces in the right place. This is another piece of the jigsaw. It's an important piece, but it does not determine what the picture shows. But what it does do is allow science to do its work.
We can only face shared threats with a shared response based on a shared commitment to solidarity and equity. That's what the pandemic accord that countries are now negotiating is all about. An agreement between nations to work in cooperation with each other, not in competition, to prepare for and respond to epidemics and pandemics. It's essential to emphasize that this accord is being negotiated by countries, for countries, and will be adopted and implemented by countries in accordance with their own national laws. The claim by some that this accord is an infringement of national sovereignty is just plain wrong. Countries and countries alone will decide what's in the accord, not the staff of WHO.